Now, Wellness Wednesday on Fox 54 News, sponsored by Regenesis.
February is American Heart Health Month, and medical professionals want to remind one important group to check their heart health: women. This Wellness Wednesday, we dive into the numbers and how you can help in a worst-case scenario.
Cardiovascular disease is the #1 cause of death in women in the United States, affecting 1 in 3 women, and this translates to about 1 death per every 80 seconds.
Christy Canty, a nurse practitioner at Huntsville Hospital Heart Center, spoke with us about women's heart health, including some of the symptoms that could be missed.
Women can often experience unusual fatigue, nausea, vomiting, shortness of breath, dizziness, and cold sweats. So not always the symptoms that you would see possibly in a male.
And the American Heart Association says it can be easy to ignore the signs.
I think back to some of my former coworkers who have experienced heart disease, and oftentimes they were feeling the physical effects, but they thought, oh, it's just a muscle ache. I'll just move on. There's nothing to worry about it.
In the case a cardiac event takes place, the association adds that there's a chance a woman might not receive CPR.
Women are less likely to receive bystander CPR than men, statistically. And so we want to take this time, too, to empower not just women, but men in general, to not feel afraid.
This afternoon, I got the chance to learn some of the basics when it comes to CPR from Go Rescue. Here's a snippet.
The biggest thing to remember is that whenever you are providing CPR to someone, that you want to keep it 100 to 120 beats per minute. A lot of times people will sing Staying Alive, or during a CPR training, that's something that they will talk about as well. And then also that you're pushing 2 to 2.5 inches deep into the chest. The CPR compressions first. You're going to use the heel of your hand. And you want to make sure to keep your elbows straight. Typically, you're going to do 2 minutes of CPR. If there is an AED present, at that time, the AED would reanalyze the heart and determine if a shot would need to be delivered. And then you would continue CPR thereafter. If there is not an AED present, the most important thing is for you to continue CPR until EMS can arrive and someone with more advanced support can be able to come in and help.
I certainly learned a lot, and I hope you learned something too. If you want to check out the full demonstration I just did with Go Rescue, you can find it and our interviews with the experts right here on Fox 54 Plus. Download on your TV, watch for free.